I think a broad look at mental health services are that we are moving away from institutional solutions to care, and moving much more towards developing real alternatives closer to people's home, out in the community, and to integrate mental health across society basically. So I expect that we'll see more mental health delivered within acute hospitals, more mental health delivered in other parts of life, such as education and so on. So in the long run, I think there is a groundswell of opinion that says mental health should be provided where you need it, and that you shouldn't have to go hunting for it. Now, I also think that a key thing about the future is that we try and get to address mental health problems as early as we possibly can. Now, that means getting to children. It means getting to adolescents. If you look at this, where do mental health problems start? 50% start before you're 14. 75% before you reach the age of 22, 23. So, key areas. It's got to be across the age range. So, starting with perinatal services, we've got to get much better services for women who are either expecting children or are in the year or two after having had children. At the moment, or at least when we started, only 15% of the country had got community-based perinatal services, and large swathes of the country didn't have beds for perinatal services. So that's a key area of change. Now, moving through into childhood and young people, there's a huge investment in those to ensure they can get access to psychological treatments, evidence-based psychological treatments, and moving further up, where early intervention services for young people with psychosis in their first episode, and then we're looking at improving the physical health of people who've got serious mental health problems. So it goes right the way through, even to older people, and we do seriously want to ensure that older people, for example, get much better access to psychological treatments. What's interesting about that is that older people actually seem to do better with psychological treatments than younger adults. So we need to make sure they get better access. I think conferences are always an important place for people to talk, share ideas, and go away and think something new, and hopefully do something new. So these are important events. I think that it's really important that we hear back how people are feeling that this is going. Now, we heard quite a lot about money not getting through, so we're putting money into CCGs, and our CCGs then spending money on mental health. Now, what people don't understand, or haven't understood, I don't think, and that's our fault, we need to get the message out there. Our first year to 18 months of the 5-year forward view has been to correct a major problem in mental health, which is a lack of data. So our view was that we need to get better data so that when we do put the investment in over the last 3.5 years of the 5-year forward, we can see what the changes are. So for me, the highlight is hearing back from the audience what their views are on the ground, and that's helpful for us.